Heart disease is the leading cause of death in the United States. The main factor in heart disease is high blood pressure. The American Heart Association says the first step in preventing high blood pressure is being aware of your blood pressure. Today I am going to demonstrate how to properly take and read a person's blood pressure. I am going to tell you the proper place to place the armband, as well as how to work the stethoscope, what sounds you are listening for, and how to properly work the sphygmometer. Heart attacks come at any given moment. I know this because my mother had a heart attack, which is the main reason why I have learned to take and monitor a person's blood pressure. I as well am learning because I plan to have a career in the medical field as a respiratory therapist. The more you monitor your blood pressure, the more you decrease your chances of having a heart attack. Your blood pressure consists of two numbers, the top number being your systolic number, and your bottom number being your diastolic. These are forces that your heart beat. To listen for these, you place the armband on your antebrachial artery, which is a few inches above your antecubital, which is the inside of your elbow. You pump the sphygmometer to about 160 to 200 millimeters of mercury, making sure the valve is completely closed so the air can get to the armbands. You then will release the valve, letting the air out slowly, and you will hear the person's heartbeat. The first beat is your top number, your systolic number, and then you keep releasing slowly till you hear the last heartbeat, which is your diastolic reading. A normal blood pressure is less than 120/80. Anything higher is hyper, but it's not unnormal to be a little over. You will need a sphygmometer, as well as a stethoscope. I am now going to show you the proper way to take a person's blood pressure. You can break down the procedure into 4 simple steps. You place the armband snugly on the antecubital part of your arm. You place the gauge in a place you can see it clearly, so you can read your numbers and know when to stop pumping, as well as seeing the numbers for your readings. You place the stethoscope in your ears, making sure they are snug so you can hear the reading. You make sure the valve is completely closed tight all the way to the left to make sure air gets through your armband. You pump to about 160/200 millimeters of mercury. And then you release till you hear the first beat, and continue releasing till you hear the last beat. And when you hear the last beat, you release the air completely. His reading was 130/80, which is not unnormal. Almost half the people with high blood pressure are unaware of it. Unlike most pains, you cannot feel high blood pressure. You should make sure to monitor it normally, and if it is higher, then seek doctor's attention. Not being aware can cost your life. Be aware and be safe.